Today I will talk about the endotracheal intubation. So there are some indication which are needed indication for doing endotracheal intubation, there's inadequate oxygenation or inadequate ventilation. Patient have some type of head injury. The patient have altered mental status. In that case, we have to do intubation. Or patient have any anticipated airway obstruction. So in this all type of indication, we have to do endotracheal intubation. So first of all, when the patient is not a dyspneic patient, so we will first try to put the patient on nasal prong, and we will check pulse oximeter. In pulse oximeter, if the SpO2 is maintained, so it's good. But if it's not maintained, we have to shift it to the bag and mask. In bag and mask also, we have to again check the pulse oximeter. In pulse oximeter, saturation oxygen is not maintained, so we have to ultimately let to the patient we should take to the patient to the procedure of intubation. After doing the intubation requires some equipments, prerequisite equipments, which include like endotracheal tube. First, the endotracheal tube, and it should be mostly used for adult male. Its size is 8 to 9 millimeter, and for the female, its size is 7 to 7.5 millimeter. Now we will require laryngoscope with the working light, which is very important. Now we have to also require 10 ml syringe, so to inflate the cuff of the endotracheal tube, and also self inflating manual resuscitation bag valve. Mask device also required. Now suction catheter is also required, and stethoscope and monitor should be placed nearby the patient and to attach to the patient before the procedure. And a disposable and tidal CO2 catheter also required. These are the equipments which are required for endotracheal intubation. Now I will tell the procedure which is done for endotracheal intubation. Now we have to attach the patient to the monitors, all the monitors. Now we have to open the mouth of the patient, and we have to we have to do suction of all the secretions, or and then we have to check for any type of injury on the dental or any type of injury, or there's any loose tooth. We have to assess the patient mouth before doing the intubation. Now after, if all things are okay, we have to position the patient. If the patient is atraumatic, we have to position the patient in sniffing position. That is, we have to extend the head slightly and flex the neck slightly. If the patient is traumatic, it's very important to immobilize the neck and head of the patient and keep the position of the patient in that position only. The patient should be totally immobilized at the time of intubation if the patient is traumatic. In atraumatic, we have to put the patient, like as I have told, in sniffing position. Now we have to go behind the head of the patient, behind the head of the patient. Now we have to start putting the laryngoscopic blade inside the mouth of the patient. Slowly we have to insert the blade inside the mouth of the patient, and during the insertion we should take care that any injury should not be take place to the mouth or the teeth. We should basically prevent any type of injury in the mouth. Now when we are putting the putting the blade inside the mouth, we have to put from the right side and try to push the tongue toward the left side. Now further we have to insert the tube and till it reaches to in between the tongue and the epiglottis. After reaching there, we have to proper visualize that glottic opening. And to proper visualizing the glottic opening, we can also do some procedure, like we can also put pressure on the thyroid cartilage. That is a burp method. Burp is backward upward right side pressure on the thyroid cartilage, and so that proper alignment is taken place, and we can easily visualize the glottic. And also we can do cricoid pressure on the cricoid downward pressure on the cricoid, and also help in visualizing that position, glottic opening. Now after we able to visualize the glottic opening and the vocal cord, we have to further insert that blade inside. We have to take the endotracheal tube. The tube we have to take, and now start inserting the tube inside the mouth of the patient from the right side. Now we have to put the tube into the glottic opening and insert that tube till the cuff is gone below the level of vocal cord. After reaching there, we have to now remove the laryngoscope blade And after remove the laryngoscope blade, we have to ask the assistant nearby person or the staff nurse to remove the stellate which is present in the tube. After removing the stellate, now we have to check the tube is in the proper position or not. For checking the tube, there are different things. So we can do clinically. We can check clinically. We can check by auscultating the patient chest from both sides, and there is an equal entry of air on both the side. It suggests of proper position of the tube. Or we can also check end tidal CO2. End tidal CO2 can also be checked, so that we can check end tidal CO2, so that we can assure that the tube is in the proper position. And also we can check the pulse oximeter if the saturation of oxygen is appropriate, so that it will also confirm that tube is in proper position. After confirming the tube is in the proper position, now we will put the tape and properly position that tube to the mouth. After tubing, again we have to check the tube is in proper position by all the methods I have told before, that is saturation and auscultation and this. And lastly, we can also ensure that the tube is in proper position by taking a post intubation X-ray, so that we can see on the X-ray the tube is in the proper position. And we have to continuously assess the end tidal CO2 till the tube is inside the patient mouth. Now along with that, there is an important note that you should have to measure the cuff pressure of the endotracheal tube every 3 to 5 hours, because if the pressure of the cuff is more than 10 to 20 centimeter of water, then it can cause record necrosis to the patient. So we have to ensure that it is not happening. So this is the procedure and things which are taken care during the type of intubation. Thank you.